Welcome to the MamasteFit podcast.
In this episode, we have Meg Scanlon, who placed first in the International Powerlifting Federation World Classic Powerlifting Championship in 2022 and second in 2023. She was around 19 months postpartum after a cesarean birth with twin girls when she won a gold medal. Meg will be sharing her postpartum return to competitive lifting and the challenges she had along the way to earn her title as world champion. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. We are really excited to have you here, Megan, and I'm really excited to talk about how you adjusted your workouts during your pregnancy with twins and then navigated a return to the platform to win like a world championship after you gave birth. So thanks for being here.
Thank you. Thank you for having me.
So can you introduce yourselves to our listeners who may or may not be familiar with you?
Sure. So I'm Megan, like you said, but I feel like it's weird not to say my name first. I'm Megan, and I am a mom of twins. Right now, they're 2.5 years old. I'm also a powerlifter. So I know that you mentioned I returned to like the world stage and won a world championship, and that was in powerlifting. So it was something I did prior to having children, and then obviously have continued after as well.
So what was your level of competition pre-pregnancy? Were you at the world level before you got pregnant?
Yeah, so before I got pregnant, I did go to like the world championship in 2019 and came in second. So I was a high level lifter before. It was at a lighter weight class than I currently compete at. So that was definitely something that was different, but yeah, pretty similar in terms of level.
So how did your workouts change when you found out that you were pregnant, or how did it not change during your pregnancy?
So I feel like it almost changed the most at the beginning and at the end for me. And it was also like the double whammy of I was pregnant at the very beginning of COVID. So everyone was home and locked down for pretty much my whole entire pregnancy. But at the beginning of my pregnancy, my workout stayed relatively similar, but the frequency was all over the place just because of how I felt. So I was kind of just listening to my body on the day and going from there. But the actual workouts and the training and the movements looked very similar to what I was doing prior to pregnancy. I would say in my second trimester was when things resembled the most of what my training would look like in general, because I felt good and I had more energy and I wasn't too big yet that I was like uncomfortable doing some movements. But towards the end of the second trimester and definitely the third, a lot of my lifting changed. Definitely squats and deadlifts changed for me a lot. Bench stayed pretty similar for me throughout because I never had any issues with it. But both of in my end of second and definitely my third trimester, a lot of my lifts changed, and also just the duration of my workouts and the intensity of my workouts dropped off a lot.
Did your provider give you any like recommendations for exercise being pregnant with twins, or were they just like terrified of like you as an athlete?
I really feel like I lucked out. Well, with my provider, she didn't necessarily have any like direct recommendations, like as an elite powerlifter pregnant with twins, but she was very open to the discussion, which I feel like was big, especially for me, because I wanted to be like forthcoming with my provider. And I wanted her to know what I was doing and see what her thoughts were, right? Not necessarily knowing anything about powerlifting, but just knowing about the body, about twins, and the stress that I was looking to put on it, essentially. So I described to her what I did before pregnancy and what I was looking to do during it. And she kind of said, use your judgment, obviously. Like, your body best, like listen to your body, but as long as you're not trying to like PR, essentially, she's like, I don't see a problem with it. Like, you were doing it before, you were doing it prior. And as long as your body's not telling you or giving you indications you should stop, like, you're going to be okay, type of deal.
What kind of percentages were you doing during pregnancy in comparison to pre-pregnancy?
I would say at the beginning, I was probably like in the 80-ish percent, 80, 85. As my pregnancy went on, it dropped off a lot. And while looking at, my VIT training videos when I was 9 months pregnant, it looks like a lot of weight, but in comparison to what I was doing before, is probably more like 60, 65%.
Okay. Yeah, that's pretty standard for even our athletes. Like, we're not lifting as much as you. I have like fangirl, like, I hope I could lift that much weight one day. I probably never will, but it's a similar adjustment for our athletes as well, where it's like the 70 to 80 in like the first and second trimester, and by the third, it's like 50 to 60% of what they were doing pre-pregnancy.
Yeah, and it's just visually, obviously, I think it's shocking to some people, and they're like, oh, you're lifting like way too much weight. And it's like, well, it is a lot of weight, but in comparison and relatively speaking, it's a lot less than prior.
Absolutely.
And that being said, my squats and my deadlifts were also like, I was squatting to a box and I was deadlifting off of blocks too at the end. So it was definitely limited in range of motion too.
So how do you think that your fitness prepared you for your birth and then like that early recovery period postpartum? Do you think it was really beneficial for you?
I do not think it prepared me for birth. But what I do think it did, and I will swear on this to the end of my life, is I ended up at the very end of my pregnancy getting HELLP. And I think that it like prolonged, or how do I want to say this? Like, made me delayed. Thank you. Delayed that happening. So I was able to make it to, I was 37 weeks and 5 days, which for twins is like kind of considered to be, full term, if you will. The goal was 38 weeks, and it was like a very short window of time where kind of my labs tanked and my blood pressure started going up. But I think if I wasn't training and I wasn't physically fit prior to pregnancy and then continuing during pregnancy, it would have happened a lot sooner.
Roxanne, can you explain what HELLP is for our listeners because it almost sounds like you're asking for help, but it is a prenatal complication.
Your body is screaming
help
for help, which is
it was screaming
the acronym. Help. So it stands for, oh my gosh, let me look this up. It's Hemolysis, elevated liver enzymes, and low platelets, and this is like life-threatening complication. Like, baby needs to be born, usually babies being born cures it in a way. But this can be related to elevated blood pressure. So normally this is a complication related to preeclampsia. So elevated blood pressures, usually above 140/90 at least, but can be like 160s/100s. And then it's just your body, it's eventually, like, your liver enzymes are super elevated, which your liver is really helpful for clotting and like blood products. So it's like your body could eventually lead into what's called DIC, where you're just bleeding everywhere if you don't get help. So it's like pretty big deal, especially if like you have to have like a C-section, because like that could lead to massive hemorrhage from birth. Because of the bleeding.
It's a good time.
It's a great time.
So it's great. Thank you for not dying.
Oh
man. I'm sure it was probably really scary in the moment to develop a pretty severe complication at the end. But I do agree that I think your fitness level probably delayed the onset of it, which is wonderful for you and your twins.
Did you have elevated blood pressures at all? Or it just kind of like literally went from 0 to 100?
0 to 100. Yes. In like 48 hours. And what was interesting was, beyond having twins, I also had like confined placental mosaicism. So it was like something that they were already like heads up for, because I had like 2 risk factors for developing preeclampsia. And I never had high blood pressure. And then I developed the first like red flag was in the like one of my urine, I peed protein. So that's when they kind of admitted me to the hospital and started taking my labs. And it was like a 48-hour window where they just started tanking. Interestingly enough, I had very high blood pressure after I delivered.
Yeah, postpartum.
Yeah.
It can take a long time to resolve postpartum, especially if it like went from 0 to 100 in like such a short period of time. Like it's very
It did
unfortunate.
take a while.
But
Yeah, it was interesting. Because there was something I was like, I felt like I was waiting for my whole pregnancy, and it was
yeah,
like, oh, it's not happening. And then getting so close. I'm like, okay, here
It's
it
like,
is.
oh, just kidding.
just kidding.
So how
Yeah,
was it healing? You had a cesarean birth with the
I did.
twins.
Yeah.
How was it healing from a C-section while also caring for twins? And then were you concerned at all how it might affect your powerlifting career?
I feel like I always say I feel like I blacked out the first couple of months, but I do remember thinking afterwards that I just had this thought that it would be so much worse, like having a C-section would be so much worse than it was. Like I really wanted to, and luckily my provider like supported me having a vaginal birth, and I ideally didn't even want like to have an epidural, and it literally went the exact opposite way, right? But I had this vision in my head that if I was going to have a C-section, like I was going to be so limited for a long period of time. And while yes, I was obviously limited in movement at the beginning, every day just I felt so much better, like in the day to day, that it kind of surprised me how well I was able to recover from it.
Was there anything specific that you were doing to support recovery from a C-section as you were returning to fitness, or just kind of your normal workout like protocols?
So I did work with a pelvic floor PT while I was pregnant and then also postpartum. So I started talking to her probably like 2 weeks postpartum and just starting some breathing, like very simple breathing and pelvic floor exercises, like scarb desensitization and then mobilization. And prior to touching weights, it just progressed like body weight, how much the baby weighs, and then slowly linearly progress back to weights I was lifting prior.
What was that timeline like for you from birth until you were like using a barbell and lifting weights to when you were feeling like you were competition ready? Like, what did that timeline look like for you?
Yeah, so I would say like 2 weeks I started breathing, reconnecting with pelvic floor, and then 4 weeks I was doing like upper body exercises and some lower body things with weights that were like equal to how much the baby's weighed, essentially. So I guess you could say everyday weights I was lifting. And from there, kind of week over week, from that 4 week mark on, I was just linearly progressing as my body felt good and wasn't giving me feedback to slow down, essentially. And I feel very lucky in the sense that once I started, I did go slow, like week over week, but it adds up fast, like month over month. And I didn't really, my body never really gave me any like signs to put the brakes on. So it really was linear progression from that like 4 week mark on. I think around 4 months was when I was like, huh, maybe I could compete again. Maybe that's something I will do. And I did end up competing at 6 months postpartum. I wasn't like back to my numbers prior yet, but I was pretty close considering. um, and it definitely wasn't my plan prior to giving birth either. But
So you started competing around like 6 months postpartum. When did you go to Worlds and win a gold medal?
so that was a year after that. So that was about a year and a half later.
Did you think that that would be the level that you were competing that soon after giving birth?
No, when I got pregnant, I waited a while. Like I always thought I would get pregnant earlier, but I waited a little while because I wanted to be ready to not compete at that level. So when I got pregnant, I kind of thought I would probably lift and I would probably compete, but not necessarily put the pressure on myself to compete at the world level. Um, and then it kind of just snowballed. And then I found myself back there. It is someone, I work with a sports psychologist and she said to me once, like, it's a part of you. Like, it's not like you become a mother and you remove that part of you. So although it may always look different, like if it fits what you're doing right now, that's why you're still doing it, which made a lot of sense to me because I definitely had a lot of problems. I would say with the mental aspect of it, of competing at a high level and having babies and thinking like I shouldn't be doing that. So I think once she said that to me, it resonated a lot because it definitely is a part of who I am. And in some way or the other, I'll always be doing it it just might look different.
So how do your workouts look now with two girls running around? I do see some videos where they're in the gym with you. How do you kind of manage like them in the gym? And I guess how do the workouts look differently now with toddlers?
Well, when they were babies, babies, it would be like my workouts were so short. They'd be like 20 minutes or something, and I'd just get in and get out. So I had like a little window of time to myself. But as I got a little older and my workouts got longer, I would bring them in the gym. And at first it was easy because they couldn't move.
Yeah. Yeah.
So I could entertain them very easily without worrying about them. I would say between 1 and 2 is probably the most difficult time because they're very mobile, very quick, but they don't quite comprehend much. So it's a lot of physical barriers. Yeah, exactly. Things took a lot longer, trying to like show them, like this is safe, this is not safe. But now they're 2.5. So now they definitely comprehend. They're very verbal, which is helpful, but also they've been in the gym for such a long period of time that it's like just a part of their everyday life, which is really cool too.
Yeah, we baby-proof our gym here, so because we have kids that are like running around the gym as folks are lifting, and then we're not doing like Olympic lifts where we're throwing barbells around, which makes it much easier to keep people safe. So we have like baby gates all over the place, like around the treadmill, around our kettlebells, and then it is just like a constant exposure. Like these kids are being exposed to the gym, and so they understand I don't run underneath this bar when somebody's lifting. And I would agree that the 1 to 2 year is the hardest because they're very mobile, but they are
very mobile.
They're very smart, but they're not like comprehending what we're saying, or maybe they are and they're not listening. Yeah. So there's a lot of like physical
learning boundaries.
Removal.
Yes. Yeah, there's a lot of physical removal.
But that's awesome that your girls are seeing you exercise and lift and compete at such a high level to know like this is something that is attainable for us as females and as women, which is like really cool. Because when I was growing up, I don't think I had a lot of exposure to like women in the gym like lifting weights. It was all like do yoga and go for walks and lift these tiny weights. And now it's like muscle mommies, and I am all about it. And I love when my girls are not, I guess just Adeline, Sophie's not talking yet, are like, I want to be strong like you. And I'm like, yes, you do. Be strong.
Right? I think it's the best. I think it's the best thing. And people always ask like, oh, are they going to get into lifting or powerlifting? I'm like, I don't know, maybe. But I think they're definitely going to be into movement because it's what they see. And I think that's something that's powerful. Like if you can figure out what type of movement suits you, like that's such a powerful thing.
Mm-hmm. Yeah, absolutely. Yeah. So I saw a recent post of yours where you were talking about like coning and how like it's not possible for you at the level that you're at to avoid it altogether. Because at a certain point we need to kind of push the boundaries of our body's capabilities in order to see improvement or to kind of get over that plateau. Could we talk more about your kind of thought process on like the never do this or the yes and no list of like what's safe postpartum and how that influenced your return to the platform?
Yeah, so for me, without a doubt, the hardest part in the recovery process was like the coning, like having diastasis. My pelvic floor was okay, like in the recovery process, and I never really had any issues, but I had a lot of diastasis issues for a very long time. And really, if I'm looking back at it, even like prior to pregnancy, like I had very wide abs, and even then you could say like, oh, she's probably, if I'm doing like toes to bar, like, oh, she's probably coning, right? Postpartum, my abs were very wide after carrying the twins and
2 babies.
2 babies in my belly growing much larger. My abs were very, very wide, and I had little control over them for a long period of time. And it was something that I started off conservative and I went slow, and similar to lifting, I kind of linearly progressed. And I think it was something that was definitely frustrating because it took a long time, longer than I thought. But what I realized when kind of taking a bird's eye view and looking back was that at the same time, it's kind of cool how long you can continue to improve on it. And I would say that in terms of how it affected my lifting, I was like, my bracing abilities were not as good. which isn't a huge deal until you're trying to hit a max lift, especially for squatting. It made my top end of my squats very unpredictable, just because I didn't have the ability to build the same tension while bracing. And it was something that I really didn't feel comfortable working on and progressing like my core work, honestly, until almost like a year ago, like a year and a half. And I was like, if I want to continue to lift at this level, and if I want to continue to try to get stronger, I'm going to have to fix the problem here, which is I'm just leaking like efficiency, like it's a huge inefficiency in my brace. So the past year or so, I've kind of progressed beyond what I was doing before and made my core work similar to what I was doing before I was pregnant, and kind of just accepted that because I was coning while I was doing it at the beginning, it didn't mean that I couldn't work on it. And at that point in time, I was confident I also wasn't, making it worse, and from last year to this year, like I've had huge progress, not only in being able to control like the coning while I'm doing higher level, like core exercises, but also being able to brace a lot better and build the tension that I was able to before, which has allowed me to squat a lot more weight.
What kind of core exercises are you doing to help kind of build the density of that tissue so it can withstand that increase in pressure for your lifts and within the core exercises?
Yeah, so I do weighted core exercises, like weighted sit-ups and things like that, which those are kind of okay for me. It was more that what was very hard for me was kind of getting my obliques back, and also anything hanging was a big struggle for me for a long time. So now like I'm back to doing like I'll do like strict toes to bar and things like that, as well as like a lot of oblique work too has really helped me in the past year.
Yeah, for our clients that have cesarean births, we find like the oblique to opposite adductor connection is sometimes a little bit hard to feel because of where the C-section incision is. It essentially like severs that anterior oblique sling. And so we find a lot of like rotational work that kind of integrates that oblique to the opposite adductor. It like really helps them feel more connected. Did you do any movements that were kind of similar like that with rotational work?
I did a lot of that early on. And then I think I was like, I don't know if I'm seeing, I got to a certain point, huge amount of improvement, and then it like kind of stalled, right? And I think for me, it was discouraging for a while, until I felt confident to like go beyond that, if that makes sense,
Yeah.
and like load more. Yeah.
So do you have any advice for like the postpartum athlete who was like competing? Now, maybe they're not all competing at like the world level, but they're competing at a certain level for them. What advice do you have for them when they find out that they're pregnant, as they're navigating their pregnancies and then returning to fitness postpartum?
I think the hardest thing, if you are competing in anything when you get pregnant and postpartum, is like giving yourself some space, like giving yourself an amount of grace that you typically don't as an athlete. So it's almost a switch in mindset more than, yeah, there's going to be physical changes and your workouts might change. But the best thing that you can do is allow your mindset to adapt to what your body needs throughout the time period. Because I think not only does it make it more enjoyable, but it also will allow you to make good decisions for your body and prepare it for like the long term, and allow yourself to be in a good position when you are postpartum working back.
Do you feel that taking your time postpartum, like inching your way back to the platform, was like really beneficial to you to not have like any hiccups or like pauses in your recovery?
I do. I also think since I wasn't necessarily planning on competing while I was pregnant, like when I was pregnant, I wasn't necessarily like, okay, I'm definitely going to do this meet postpartum. It didn't give me a timeline. And I think since I didn't necessarily have a timeline, it was very, very helpful.
Yeah, for me with my own, like I don't compete at all with like lifting, or I don't even run 5Ks and stuff, but I definitely
Yeah.
find that because my fitness for myself is just about like my health and being able to like pick up my kids and play with them without being in pain, it allows me to be like really patient with like my healing process, because I'm like, well, what am I like, why would I rush this process? Because for me, like, I definitely identified myself as an athlete, and based on my physical performance before like my first. And then during my first pregnancy, for whatever reason, I was like, I'm going to listen to my body and what my body
Full
needs.
180
which
from
was
who she
like
is.
not normal for me. I was like, you know what? I shouldn't do Olympic lifts because it's my belly is impeding my bar path, and I should lower. It was very very strange for me. I'm really glad that I did it. And then during my pregnancy, I was like, okay, well, me as an athlete does not define my value as a person. Like, fitness is important to me, but there's other aspects to my identity that are equally as important. And, honoring my time during this pregnancy is really special, and it really allowed me to kind of connect with what my body was needing each day by taking the pressure to like physically perform. Because I'm like, well, what am I doing? Like, what am I training for right now? Like, for my own health and well-being. And I think that really translated well for me going into my labor. Was you can't always predict what's going to happen at the end of your pregnancy or even how your birth will go. And so having this like growth mindset where you're like, okay, well, I'm going to take each day as it is. Yeah, I might have a plan for my workout, but I'm not going to like force myself to do it if I'm just not feeling it that day, or I don't want to have to modify, but I need to do box squats now because I need some more support. My low back is not loving these like normal back squats. And because I had that mindset where I was just like really open-minded to the experience, when I went into labor, I was more open-minded to the challenges that I felt. Or for you, like navigating a very different birth path that you were probably planning, was just you're opening yourself up to the experience, which then I think translates very well into motherhood and into parenthood, because we have these small people that have a lot of opinions on how they would like things to be. And like, I would really love a baby that just slept through the whole night, and like that would be fantastic. They have opinions. Like, I would like my kid to just get in the car when I tell them to. They have an opinion.
When it's time to leave the pool.
Yeah, I think like you're saying, that being open-minded and the flexibility, like in the being flexible, having a flexible mindset, similar, like prior to pregnancy, I wasn't super flexible, especially like as an athlete, but now I'm very, I mean, within means, I'm very flexible, right? So I always say there's 24 hours. It might always look different, but it will get done somehow. But I think it's made me a better athlete.
I think it's made me going through pregnancy and then giving birth and being postpartum has made me a better athlete too, because my mindset is like so different now. I don't have the same like aches and pains that I did pre-pregnancy. Like, I move better in my body because I took the time to like understand what these cues for my body were. So I'm like, oh, I don't just train through pain. Like, okay, I guess. So it's like, what's the normal amount of pain? Is 0.
Yeah, right.
And so it's definitely made me a better athlete. And I'm just like, the weekend warrior. Like, I'm not competing at any level, and I think for most folks and folks that are probably listening to this podcast, like, we're exercising for our health. We're exercising to feel strong so that you can pick up your kids and play with them without being in pain. And that doesn't mean go to the gym and kill yourself every day to be so sore that you can barely walk or sit down on the toilet. Or like to push through pain or signs from your body that are saying, hey, like, I need you to slow down. Like, this is too much for me. But yeah, postpartum has made me I learned what a pelvic floor was, I realized how crucial that was for a lot of things.
I know. It's true. It's true. It's definitely something that, yeah, both the physical experience and just how like mentally, I mean, I guess you don't have to change, right? Like, you don't have to adapt and be open to changing, like listening to your body. But if you are someone that necessarily is going into pregnancy and is kind of like the push through person, like, I couldn't recommend that being your one change more. Is just like opening your mindset to being, to taking what's there on any given day. And sometimes that means nothing, which is something I never would have thought I would have said prior to pregnancy, but.
That's awesome. How did you know to work with a pelvic floor physical therapist during pregnancy? That's pretty uncommon that folks even, one, know what a pelvic floor physical therapist is, and then know that you can work with one during pregnancy.
Yeah. So I did know what one was, but I never worked with one prior to pregnancy. And I kind of lucked out. I hooked up with a pelvic floor PT that works with a lot of different powerlifters and weightlifters and sport athletes. And she's from Australia, so it was virtual during COVID, which was also a good thing because I wasn't going anywhere. And then afterwards, I like checked in with her, and she helped me create a plan to kind of get back under the barbell. And I also saw like a local pelvic floor PT just to get like a hands-on eval too. Mostly for my peace of mind and making sure like I was doing right by my body.
That's awesome. Yeah, I think the coolest thing, one of the good things from the whole pandemic was that all this virtual options started coming around where like you don't have to physically go somewhere to get support, which as a new mom I find to be very helpful. And so like having the virtual support even with physical therapy I think is like really awesome. Did you find that the virtual support that you received was like pretty similar to the in-person support? Like they obviously each offer different benefits, but how would you compare the two for you?
Yeah, I mean, very similar, in terms of approach and what they were recommending to me, which I think was also helpful for me to just kind of like reaffirm I was taking the right path. I mostly went to like an in-person pelvic floor PT postpartum. It was like as I started lifting and I was like, I just want to cover all of my bases. Like, I don't want to look back a year from now and be like, oh, I wish I had gotten an in-person eval because, because I was like, I just felt like, I don't know why. I was like, I want to make sure that I'm like ready to put more load on the bar and not just myself in my head telling me that I am ready. And yeah, I feel like outside of like the eval, what they actually told me in their recommendations were very similar.
What kind of things were they assessing for during your pelvic floor in-person session to let you know that you were ready to get underneath the bar again?
So virtually, well, and her name was Julie. I worked with her when I was pregnant. We tried to just build awareness between both my core and pelvic floor. And then as I progressed along, we did a lot of like relaxation. And then postpartum, initially she just kind of asked me to like bring the awareness back. And when I was doing breathing drills, and she did have me like check for diastasis, kind of whatever. She like brought me through how to check for diastasis. And then basically like for her, it was more, she was telling me things to look out for as I started moving again, for my pelvic floor. She kind of just said like like I didn't have any prolapse. My pelvic floor was almost like, hyper like a hypertonic rather than, so it was almost like I had no relaxation in my body, which makes a lot of sense, despite trying to relax my pelvic floor all of my pregnancy. So like that my strength was good, my coordination of my pelvic floor was good. So primarily she just recommended that I work on, again, relaxation techniques, more for my life. In lifting it was okay, but I was almost having like UTI symptoms because of my pelvic floor
Oh man.
always being turned on.
Yeah.
Yeah.
What were some of the symptoms that the virtual PT was telling you to look for to know that you needed to pull back a little bit or potentially even modify? And what were some things that you saw during your pregnancy that let you know that you needed to pull back a little bit?
Yeah. I mean, during my pregnancy, definitely, and even postpartum, like any heaviness or obviously pain, but heaviness, especially if it is something that is progressing as you're working out or after, as well as any like incontinence or leaking during training, which I didn't have while I was pregnant. And honestly, even when I did modify, it was more because of my size. Like I was just uncomfortable with full range of motion anymore, rather than having any being symptomatic. And then postpartum, a lot of the same things. And then just like if my bleeding picked up as well when I was early on postpartum.
Okay. So do you have any last advice for folks that are navigating the perinatal time frame as an athlete? Could even be like weekend warrior like me. And then also tips for folks to like, or advice for anybody that wants to integrate their children into their workouts to kind of expose them to like a love for fitness?
Yeah, I think advice wise, I always tell people because I always be like, oh, well, like, you're going to worlds. I'm like, yeah, but everyone has their world. It's just what it is. And if it's something that you're passionate about and it brings a lot and adds a lot to your life, then it's important. And it's just figuring out what it looks like in this season of your life with small children. And it's going to look a lot different, but that doesn't mean it can't be just as great. So it's being patient because it's going to change a lot over the course of the first couple of years. And you're going to think you have it figured out, and then you're going to have to figure it out again. And that's okay. And the same thing with having kids in the gym. I'm so glad that I have a home gym, and I'm lucky enough to have the girls in the gym and have been able to teach them about the gym. But it definitely is something that takes a lot of patience and knowing that workouts are likely either going to have to change a bit or be cut short or take you a lot longer. And it's okay. Like it doesn't have to be perfect or look perfect. It can look a lot different and still be just as functional and efficient.
I mean, you still made it to Worlds in one-year class, so obviously having your workouts interrupted by small children didn't completely derail your performance.
Maybe it increased your gains.
Right? It gave me a little extra rest.
How can our listeners find you, and what support do you offer for them if they're wanting to do powerlifting? I know you have some like online programs and coaching.
Yeah, so I'm mostly on Instagram. My Instagram is Meg Scanlon. And I work with powerlifters of all different abilities, and also some that become pregnant and become mothers. What's exciting to me in the sport is I think it's something that we're seeing a lot more of is women who are having children and then coming back to compete with young children, or start, competing before getting pregnant, having children, coming back to compete. As the sport has grown a lot in the past 5-7 years, it's something that we're seeing more and more of because there's more females competing in the sport. And I think that's something that's really, really cool. Even, 3 years ago when I was pregnant, I was kind of looking at CrossFit athletes as just to have like what are they doing while they're pregnant and how are they getting back to competition? Because there wasn't much of an example within powerlifting at the time. But it's something that is happening more and more, and it's a very exciting thing to see. Because it's cool to be strong.
It is.
And it's really cool for your children to see you be strong as well.
Every time I see a video of you lifting, I'm like, I'm going to lift more weight today. And I'll throw an extra 10 pounds. I was really proud of myself. I did like 155 pounds in my squat. And I was like, yeah, that's what she squats in kilos. I'm right on track. One day.
I just want upper body strength. Like, that's all.
My bench is not as impressive. I don't even think I'm doing the pounds that you do in kilos.
I always say I feel like I had a leg up because I did gymnastics as a child. So I was like, I had a leg up when I started benching.
I know. Yeah. We enrolled our children into gymnastics because we're like, you will have upper body strength.
You will be able to do handstand walks.
You will not have spaghetti arms like us.
Right. But learning how to do a pull up, I don't even remember. Like that's weird, but like I don't even remember because I was so little.
Yeah, you just something you've always done.
That's awesome.
Yeah.
Well, thank you so much for being on the podcast and letting us interview you about your pregnancy journey and how you returned to win gold medals like a year and a half postpartum, which was super awesome. And I think what's even cooler is that you really took your time to heal postpartum, which is, you don't always see that when you're watching like professional athletes. It's kind of like they're back in the gym at 4 weeks, like deadlifting all this weight. And so I think watching your journey to make it back to the level that you competed at is like a really great example for other folks, even if they're not trying to steal your championship from you.
So more the merrier.
Yeah. So thank you so much for being on the podcast. We'll link in our show notes ways for folks to find you and to grab your programs. So I'm always like very tempted because I'm like, I'll be as strong as her if I do her programming.
You have to stop getting pregnant.
I know. I have to stop reproducing.
Yeah. Just for a little while.
That's my big goal after baby number 4 is I'm like, I'm going to get strong AF. I'm going to be just like Meg Scanlon.
You know what? But you know what's really fun about doing it postpartum is the fact that you feel like you have newbie gains again.
Yeah.
Even though they're numbers you've
gosh.
hit before, but you're like, oh, I can just add more weight this week. This is great.
It's like, look at me just PRing constantly.
Yeah.
Honestly.
Exactly.
It's a really good motivating tool. It makes you feel good about yourself.
I know. Well, thank you so much again for being on the podcast. And for those of you that are listening, you can find Meg on her Instagram. She has a lot of amazing programs coaching athletes of all sorts of levels. So definitely check her out.
Thank you.
Thanks for joining us today and listening to this episode. If you want more support throughout your pregnancy, join our prenatal fitness programs and childbirth education course. If you need more support after birth, join our postpartum fitness programs and education courses. If you're a professional, we offer birth worker and fitness trainer courses so you can learn from us and earn CEUs. Explore all of our courses on our website at MamasteFit.com and use code STORY10 to save 10% off all of our programs.
If you enjoyed this episode, please follow our podcast to be notified when we release new episodes. Leave a review and share with all of your friends, literally everyone you know that is within the perinatal time frame. We release new episodes every Wednesday.
This podcast is sponsored by Needed, a nutrition company focused on optimal nourishment for your perinatal journey, and Crossover Symmetry, world-class training and equipment for pain, fitness, and performance.
Use code MamastePod for 20% off your first Needed order and code MamasteFit for 20% off your Crossover Symmetry shoulder system.